Question number 11, Louise Upston.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what progress is the government making with its funded family care policy?
Honourable Tony Ryle.
Well, Mr Speaker, when the government's $92 million funded family care policy becomes effective, New Zealand will be only the third country in the world to pay a wage to some family members who care for their adult disabled children. The new policy being implemented will enable around 1,600 disabled adults who meet the high and very high needs eligibility criteria to pay resident family members to care for them at home for up to 40 hours a week, if that's their choice. It is expected that from the 1st of October 2013 this year, needs assessment and service coordination organisations will begin assessing people for eligibility for funded family care.
Supplementary question, Louise Upston.
Thank you, Mr Speaker. What other progress is being made with the government's funded family care policy?
Honourable Tony Ryle.
Mr Speaker, the Ministry of Health has worked with representatives of the disability and carer communities to draft plain language funding rules which will set out the terms and conditions for payment. Disability groups have been consulted on appropriate quality and safety monitoring that will be needed for funded family care, and advice and guidance materials are being developed to support eligible disabled adults deciding whether or not to apply for funded family care. Information on how the scheme works and how people can be assessed for funded family care will be available in the next 2 years. This government is contributing $92 million to the establishment of funded family care, and it observes that even in the best of economic times in this country, the party opposite couldn't even find $1 for funded family care.
Question number 12, Sue Moroney.
Thank you, Mr Speaker.